To summarize A1C, here is the comparison between blood glucose and A1C. Blood glucose gives a glimpse for 1 second out of 86,400 seconds in a day. Morning blood glucose levels may be perfectly normal with very high or low afternoon, evening and night levels. Testing for A1C along with daily blood glucose testing will help address this problem. A1C is created by contact of glucose with hemoglobin over time, 4 to 12 weeks. It tells the average of blood glucose levels in the past 4 to 12 weeks, approximately 100 up to 120 days. Higher the glucose levels, higher the A1C. In non-diabetics, the A1C ranges from 4.5 to 6. These are the goals for A1C levels. If you see in diabetic individuals, these levels should be below 7 as per American Diabetes Association and below 6.5 as per American Endocrine Society, and as we have discussed, much of this is individualized, that how well the patient can recognize and treat hypoglycemia, which is associated when you attempt to decrease A1C levels. Here is a rough comparison of average glucose readings with the A1C levels. So a level of 6 corresponds with an average blood glucose of 120, of 8 with 180, and so on. What is the best goal? The best goal is the level of A1C below 7 or 6.5 in the absence of significant hypoglycemia or hypos. We have discussed hypoglycemias can be very dangerous to a person's health and life. Your expected level will depend on how well you can control and manage low blood glucose if it occurs. Even then, in any case, the attempt should be made to bring the level down to approximately 7. A1C test now can be done even at home, and the kit is like a blood glucose testing strip, and it is available in the pharmacies. High A1C levels are associated with higher chances of kidney disease necessitating dialysis or renal transplant, higher chances of nerve damage, increasing the chances of foot amputations, higher chances of heart attack, stroke and impotence, higher rate of hospitalization, and higher diabetes related medical expenses for these patients. The higher the A1C value, the higher the chances. Rarely A1C levels can be affected because of problems with hemoglobin, many a times genetic, but it's very rare. So if your A1C level doesn't show a good control despite your sugars being under very good control on a 24/7 basis, 24 hours a day, 7 days a week, then this possibility should be considered. For any reason, if the red cells are destroyed faster or slower than they should be. Usually they are destroyed in 120 days, and that's why we say that A1C takes 120 days to form. But if the life period of the blood, the hemoglobin part called the red cell, is changed, is not normal, then the A1C levels may not be normal. A very high and very low blood glucose levels in a single patient will average out and will show a normal A1C. What I mean by that is that a patient may be having blood glucose levels of 200 in the morning and say 60 at night on a daily basis, or are regularly having wide fluctuations in levels. Because A1C is an average, so this patient will show a normal A1C, and that is why we said that when you are reading the A1Cs, also look for episodes of hypoglycemia. So wide fluctuations where sometimes the blood glucose levels are very high and sometimes very low will give an average that will falsely appear as in the normal range. If your A1C levels are high, discuss with your doctor, who will review your medication, the dosages and timings. Discuss with your nutritionist or dietitian, who will review what you are eating, when you are eating and how you are eating. With your doctor's consent, increase physical activity, which will further help bring down blood glucose levels, but avoid physical activity if your levels of blood glucose are over 240 mg%. But again, ask your doctor what is the best permissible physical activity that you can undertake. Normally, A1C should be followed 2 to 4 times in a year if normal. If it is high, it need to be followed more frequently. However, do not repeat A1C test for up to 6 weeks after changing the anti-diabetic medication or changing your diet, because it takes at least 6 weeks for the effect to be shown in the A1C levels. To summarize, A1C is the most important single blood test that helps you to understand your blood glucose control and therefore probability of future complications and costs of your diabetes. So it's a crystal ball which shows the future to a diabetic patient.